Hello everyone. Today's my last day in my apartment. I'm actually moving out in a couple of hours. But before I leave, I wanted to record my experiences of getting eye surgery here in Korea. So definitely before I came here, I've always wanted to get this done because I've had to wear glasses ever since middle school. And I've been wearing glasses for like more than a decade basically, so I was just thinking that it's time to get my vision corrected. I know some people say for you to wait until your visions get really bad and then go get surgery, but my vision is pretty bad, and I was like, if it gets worse then it will later, but I want to have clear vision now, so that's why I went to go get it. And I got it done in South Korea. I went to BGN Eye Clinic, and I do recommend that if you guys are visiting Seoul or you live near Seoul, because this clinic gets lots of foreigners as their patients. Don't be worried if they don't speak English, because if anything they will speak English. Because there are some foreigners working there. If not, there are some Korean staff that can speak English. And the reason why I'm stressing this is because communication is very important, and if you don't have that and language is going to be a barrier, then like getting surgery done in another country is not safe. In terms of the price, it's always going to be competitive, so it's up to you if you want to do your own research. I just think that you should definitely invest in your eyes just because it's your vision, so it's very important. I wouldn't go cheap on any surgery, like whether it's your eyes or not. The actual price itself, I don't know if it's displayed on the website or not, but you can find it somewhere. That's how I found it. Okay, the surgery itself costs 2,600,000 Korean won, which roughly translates to, I want to say like 2,500 or 2,400 USD, which is really cheap, and that's for 2 eyes, and that's for your free consultation and your post consultations that are free, not including the eye drops. Basically, if you are really down to do the surgery, they're gonna ask you for a DNA sample just to test you for like any possible disease in your eyes or whatever in your body that will affect the surgery. And that's $100. That's going to be a deposit towards the surgery. So then on the day of the surgery, you pay 2,500,000 Korean won. I have my receipt to prove it. So this is the surgery price, and then this is the deposit price. The cost of the eye drops, it was 66,000 won. This is the price of the eye drops. That's including the 2 antibacterial drops and then the artificial tears. It was basically 2,600 USD. Alright, let's talk about the consultation before you actually get the surgery. So when you go into BGN Eye Clinic, the first thing you notice is that there are lots of people there waiting to get different kinds of tests done, and it's a really nice, like fancy clinic, like it looks like a hotel. Okay, you go in there and you do all these different tests, and you get this pamphlet at the end. The first consultation is always free, and I believe the post-surgery checkups are also free, like included in your overall price. So when you get this pamphlet, it basically tells you all the things you need to know about your eyes, even though you may not know what they are. See, my vision was like really bad. I was like a -4 on each eye, and some people are not even as blind as me. Like they'll be like -2 or -1 even, and they still go get their vision corrected. So for me, yeah, like I'm really blind and I don't have stigmatism or anything like that, so I was able to be qualified for the surgery. They check your eyes to make sure that you can actually do the surgery and that it'll be safe, and they also check your cornea thickness. Of course, they'll have to cut it. If you go in for the consultation, if you want to get the surgery on the same day, you can do that. That's an option. But for me, I was like freaked out. I needed a whole week to prepare myself mentally, so I went for a consultation. The next following weekend, I went in for my actual surgery. There are different kinds of surgeries you can get at this clinic for your eyes, but I'll just talk about the 3 main ones because that's what people mostly get anyways. So the first one is LASIK. The second one is LASIK, and the third one is SMILE, and I believe they offer a 4th one, which is like a customized upgraded version of SMILE, which is like the triple premium SMILE surgery. Basically, they all do the same thing. They correct your vision. It's just how they do it is different. For LASIK, they cut the entire half of your cornea off, so then the laser goes in and corrects your vision, and then you have no cornea whatsoever covering your eye. That thing is just going to grow by itself. That's what they told me. It will hurt in post-surgery, but then they said that if you want your cornea to fully recover and develop a new skin, then this is like, I guess, the best way to go. But then I don't really recommend it. I feel like it's not safe for your eye just to be exposed because they don't put it back, so it's like cut off. Okay, so I don't know who have done it. I don't recommend it. Like, just me talking about it sounds scary. And the second one is LASIK. So with LASIK, they still cut your cornea, but I think they do like 3/4, so you have like your cornea flat. And then they do the same thing. They put a laser through it to correct your vision, and then they put it back. So then on like LASIK, where they cut like the top half of your cornea off, LASIK, they just cut 3/4 of it, and the flap is here, and they put it back in, and then you know you're like good to go. So with LASIK and LASIK, you will feel pain post-surgery just because the numbing effect will go off. And of course, when you're getting the surgery done, you're not going to feel any pain. You're not supposed to. If you are, then like, you know, you should really tell them, because they are cutting your eye. It's really funny because people just assume that it hurts. It doesn't hurt during surgery. I think after the surgery is when you start feeling the pain. And then for me, what I got was the smile surgery, which is like the latest version of the eye correcting vision surgery. So unlike LASIK and LASIK, they don't cut your cornea and then like put it open, or don't cut it off. They just cut like a very small incision on both eyes. They use that to like dig in there and pull out a flap. Okay, so let me explain it from the beginning so you don't just get disgusted. Well, why were they pulling out a flap from your eyes? Okay, that flap was created. It wasn't there to begin with. There are two sides to the clinic. There's the consultation and like the eye checkup side, and then the other side is the actual surgery. I went to the other side that day, and man, they did some checkup just to double check that I was okay to get surgery. And then after that, I went to a room in the back. I sanitized my hands, I washed my face, and they put me in like hospital gown. And after that, they dilated my eyes, I believe, and then they also put numbing liquid in my eyes. I had to wait for it to like settle in so my eyes don't feel anything. And after that, I was just waiting, and then okay, we're ready for your surgery. And I was like, okay, let's go. And like, I guess it didn't really hit me until the doors open and I went to like the room the surgery was actually happening, like the big machine, like the white walls. And I was like, oh my god, I'm actually getting this done. Be awake and aware. So that's the kind of mentality I had. So you have to go and lay down under the machine. The machine will tell you everything in English. It tells you to look in this like green light, which is the laser. I think it used to be red, but they changed it to green, so that's not so scary. And then you just look at the laser for 10 seconds, and then the laser is going to create like a white flap from your cornea. I don't know what it's doing exactly, but it's creating like another layer, I guess. So they're gonna create it so that this is your eye, this is the laser. Just keep staring at it, and it'll create the flap. And when after that is done, that's it. You don't need to worry about no more laser. And then they're going to cut a small incision in your eye, and then they're going to use a curved tool to go in there and like cut around the cornea part so they can pull out the flap. And I think that was the most nerve-wracking part for me, because even though I don't feel any pain, like you could see the tool that they're using, like, you know, tugging around my eye, and then they like pull it out. After they removed the flap, almost immediately you could see better. Nothing was painful, nothing was like crazy scary. It was just like freaky, you know. It was just like, oh, is there something tugging at my eye, and just like ugh. So after you are done with your surgery, right away you have to go get prescription medicine for your eyes, and mainly it's just eye drops. So what you have to buy after post-surgery is of course on your own. That it's not included in the surgery. It's like an extra thing you have to do. And with my surgery, you get the PRP eye drops, which is essentially like an eye serum made from your own blood. So you get the smile surgery, it's already included in the price. I believe LASIK and LASIK you have to pay extra for this. They draw your blood, and then they take the plasma from your blood, and they like make it into a serum, and they give it to you. And this thing has to be cool like constantly, so you can't like go out and take this with you. This is not from the pharmacy, this is from the clinic. What you actually buy at the pharmacy are these three things. Okay, the first two things you would get are these two eye drops. I did research on them. They're basically just antibacterial solutions that you put in your eyes to prevent bacterial infections. If you want to know what they look like, the white one, it just looks like this light green liquid, and then the other is just a clear liquid. And you use these in combinations with each other with a minute interval in between. And then of course you have to buy artificial tears. The reason why they give you this is because once your cornea is cut, it is prone to infection and getting very dry. And the last thing you want to do is have dry eyes, because then that would defeat the whole purpose of getting surgery. Because if your cornea gets wrinkly or like the flap even gets damaged, it's probably because your eyes are not hydrated. So you need to keep it hydrated with artificial tears. If you already have severe dryness in your eye, then that's definitely something you need to mention, because that's something that will affect you later in your post-surgery. So I do recommend that you bring somebody with you. They told me not to bring anybody with me and that my vision will be fine, but honestly, because your eyes are dilated, your vision is going to be blurry anyways, so you do need somebody to help you get around, especially if you don't live in Seoul. If you live in Seoul, then you can just go to your hotel or your apartment, you should be fine. But for me, I had to take the bus home, so I need somebody to go with me so that they can see like the bus number. Fast and painless. I think that's one of the most important thing that people stress, is that it's a painless surgery, because one, you are awake, you are not like under any gas, so you will not be sleeping. And I don't know why people assume that they'll be sleeping getting an eye surgery. This is not your double eyelids, it's your freaking eyes, so you're gonna be awake, because if you go to sleep, your eyes roll back, so it doesn't work out. Like, I'm a really calm person myself, and I was already nervous, but I cannot imagine like a person who's like this getting surgery and their eyes are like wobbling. I also have information about a retinal laser treatment. The reason why I'm talking about this is because when they were looking at my eyes, they thought that my left eye, it had like a retinal tear in the back, so like I was going to possibly get like a treatment on my left eye, but I got it checked again and they said actually I don't need it, I'm fine, but I should get it checked like every single year. I just want to tell you guys anyways, because I already got the information. So if you do know somebody who needs it, or you are someone who needs a retinal laser treatment, you can also go to this clinic. And I'll just read off this paper. They said that it's going to take at least 1 hour or to 30 minutes, because they have to dilate your eyes like really big so they can see like the back of your eye, and that's the longest part. It's not like the actual surgery itself, it's like the waiting part. We'll have hazy images for 36 hours of the treatment. Even though I didn't get the treatment, I did get like hazy images, and like lights were affecting, you know, like the way I see on my left eye. And if your eyes are dilated, yes, you will be sensitive to light, and that can cause you like headaches. For one eye is 30,000 won, for both eyes is 50,000 won. So if you do the math, it's less than like $50 USD to get both eyes fixed. I just think that it's really awesome that they offer this service here, and it's super cheap. If you're down to get the surgery, you know, I hope that everything goes smoothly for you, and of course think about the kind of surgery you want to do. So this clinic is super clean, super safe, friendly staffs, English speaking staff, which I know that foreigners like us really need, because you know it is a medical procedure and we don't want to feel unsafe. And I got the surgery like 3 weeks ago, so far my vision's been good. I have to be wary of bright lights because it will, you know, affect my recovery, so like I always wear sunglasses when I go out. It's pretty amazing to see things like almost 2020. I hope this video was informative and helpful, and that you guys can use this video to help you make a decision whether you want to go through it or not in Korea. If you live in Korea, it's better for you to get the surgery here, because you can always come back for the checkups. But then if you're coming here as like a tourist, I say stay in Korea for like about a week, because it is your eyes and you want to recover before you go back on the airplane. Give yourself some time to rest before you actually go back home. And if you're considering this surgery, I do recommend this clinic. If not, do your own research. Thank you guys for watching my video. I'll see you guys next time. Bye!